Welcome to the Natural Balance Hoof Care Corner. Today's project is going to take us to a nice little 6-year-old quarter horse mare who's been lame for a little over a year now. And she came to me as a referral from a veterinarian. And he's been working with her some, so has been unsuccessful in getting her sound. And there's been several very good farriers that have worked on her as well. And so we find ourselves in this situation quite frequently, actually, because of the minor deviations that this mare has. And it's oftentimes difficult for farriers to look at these type of things in the same view that we do. And because we use different principles, we sometimes get around those issues of lameness and get the horses back to soundness. So with that, I looked at the x-rays, and we'll take another look at them, and I'll show you what got me excited about this particular project. And I also went from the x-rays to the horse's foot, did some mapping, and found that from the widest part of the foot to the end of the toe was nearly twice as long as it was to the back. And that's a huge thing that even horse owners, farriers and veterinarians can look at and say, if there's a stark difference in those measurements, then the horse is going to be lame in a period of time. And with that, we can make those corrections and alterations, and for the most part, we can offer these horses a higher level of soundness, and if they're caught in time, we can get them back to full soundness, back to pre-disease condition. So let's go to the x-ray box and see what I'm talking about here. This is her left front foot. Generally speaking, the widest part of that foot will fall someplace within the condyles of the distal end of P2, which is right here. Now you can see faintly the end of her heel right here. Now they've pulled the shoes off to get these films taken, so the distance from there to there is a very short, basically an inch or a little bit more, and the distance out here to the end of the toe is 2 to 3 times longer than that. So those are the kind of things that we look at when we look at these x-rays. We want to make sure that these ratios from this center point are equally proportioned, and that's what our goal is going to be when we start to address the trimming and the shoe placement on this little mare. There's some other things that are very nice. All of these joints seem to be fine. The veterinarian told me, he says he couldn't see anything basically wrong with the bones or the joint surfaces, which is a real plus. Her age is in her favor. And so we're going to take that approach, and hopefully we can get her back to a higher level of soundness. I think the thing that I've noticed very consistently is that she's landing very much on her toes. The other day when I looked at her, it's been 2 days ago since I saw her, and I see an improvement from when she was moving the other day. But you can see she hasn't been trimmed for about 4, 5, 6 weeks. You notice the way she turns. She's very uncomfortable. That's generally, we see that may be some coffin joint, extra leverage that's putting pressure on those ligaments around the coffin joint. You see she's very reluctant to go. She's just not happy at all turning a corner, and it's with every single step. Now she's been shod for about 2 months. The shoes were pulled less than a week ago, and so there is some extra growth that you need to consider. However, what's been my experience is that if they're that far out of balance in 2 months, they were basically not in balance when the shoes were applied. And that's not the fault of the farriers. It's just that there's a different set of guidelines that we use to prepare these feet and place the shoes that's slightly different than what we were basically taught. And with feet like this, they become very challenging because first of all, there's 2 feet that are slightly different. We were taught that we're supposed to make those 2 feet the same. That in my experiences, that's been the reason why the majority of these horses start to get lame, is trying to make each foot look the same as the other, when in fact they were never intended to be that way. And making them the same, you're sacrificing both feet to make them look different than each one of them should be.
Okay, this is what I saw the other day when I chose to take this horse on as a project. I look at the widest part of the foot, and we're looking at the sole portion here. I just briefly measured back 1 inch from the apex of the frog, and on this smaller foot, it's probably just inside of 1 inch. So there's basically the widest part of her foot, and we saw the same thing on the x-rays. This is the end of her heel there, and that's the end of her toe. And you can see where there's at least 2 portions of this toe that are ahead of that heel. And that's a substantial amount, and it certainly can be accountable for why she's so sore and moving. You have to realize that these horses were designed to wear their feet very close to the tip of the coffin bone, which is the tip of the bone is right there, and this wall is in its normal state is worn back to this part right here. So any amount of extra growth beyond that is going to create leverage for every step they take, not only forward, but every turn they take. And that's why she's so uncomfortable in her turns, is just that this distance is so much greater in the front than it is in the back. I want to just take this hoof, this leg, and show you inside what we're talking about. This is a foot that's fairly similar to the one that we're going to be working on. You notice that there seems to be a little extra length out in front here. We look at this from the inside, and we actually see the bone inside of the foot and all of the references that I was referring to, both on the radiographs and from the live foot. I want you to look at the bottom of this foot, slightly larger foot. The widest part of this foot is, again, approximately 1 inch behind the apex of the frog. That's where that center of that articulating surface is. Remember, I pointed that out on the radiographs. Below this center of these 2 condyles is where the widest part of this foot is. And you notice that this arc of the sole corresponds with this spot right here. So with this foot, there's not quite the disparity that you see on the foot on this mare that we're going to be working on. There's the widest part of her foot. The distance is here, and it's just about the same, slightly longer. Okay? So you see how these external references refer very specifically to the internal structures. Now, I want to show you, this is the leverage. The deep flexor tendon is listed in yellow here. It pivots over the top of the navicular bone, which is right here. Now, its attachment, the deep flexor tendon attachment is right there. There's approximately 1 inch in that distance. The feet that are naturally worn and barefooted, not only the wild horses, but the domestic barefooted horses, that distance to the point of normal breakover is equal to the fulcrum point of this tendon over the navicular bone. So you can see that this extra wall out here is creating an extra leverage. Keep in mind, the little mare that we're working on here has at least 2 times this distance ahead of that widest part of the foot. That's a lot. So we expect to get some good results from her. Granted, you can't predict the future, but we're going to work at it diligently. We're going to follow the same basic guidelines that we do with every foot that we work on, both as a treatment protocol as well as a prevention protocol. So we're just basically going to find the live sole. We're going to trim the heels to increase the length and width of the back of the foot. We're going to place the breakover of the front of that shoe at a place that is reasonable and sensible as far as leverage is concerned.
That's all the time we have for this week. Please join us next week as we continue working on this little mare. If you would like more information or a free informational DVD, please call us or visit nbhoofcare.com/TV.